Your body goes through many changes when you're expecting a baby. From weight gain to back pain, discomfort can go hand in hand with the excitement and joy you feel as you wait to meet your new baby. Well, pregnancy can also impact your heart. In today's Wellness Wednesday, sponsored by Advent Health, Dr. Bill Bradfield, an obstetrics and gynecology physician, joins us to talk about heart health for expecting and new moms. So welcome to the show. So great to have you here.
Thanks for having me.
Yeah, it's been a little while since I was an expectant mom, but I was telling you earlier that I didn't really have any complications or heart issues, but a lot of women do. Can you talk a little bit about that?
Sure. Well, the heart goes through a significant change when you're pregnant. The blood volume is increased by 50%. The amount of work that the heart has to do to pump that blood through the body is significantly increased. So there's a lot of strain put on a heart during pregnancy.
Yeah. Well, can we talk about some of the risks, when it comes to the heart when you're expecting a baby?
Sure. So heart risk depends on pre-existing conditions to a certain extent. And some women come into pregnancy with cardiac arrhythmias, where the heart beats too slow or too quickly or with an unusual beat. That can be risky during pregnancy. It can lead to blood clots and things like that. So patients who have a cardiac arrhythmia before pregnancy, who take medications for that condition, need to continue taking those medications during pregnancy or switch to appropriate medications during pregnancy.
Yeah.
There are patients who have valvular heart problems. So, as you know, the heart has 4 valves that keep blood flowing in the proper direction. If those valves are sick or damaged, the valves have a hard time handling the increased blood volume of pregnancy.
Yeah. So what exactly happens to your heart maybe during birth and maybe right after?
Sure. Yeah. During labor, the even more strain is put on the heart than pregnancy itself, especially when a patient is pushing. So the amount of work that the heart goes through during pushing in childbirth is significant. And even after birth, there's all that blood that was there during pregnancy is still there after the baby is born. So it takes a good 3 weeks to almost 3 months for the heart to get back to its normal pre-pregnancy state after the baby is born.
Yeah, I don't think a lot of people realize that. So during that time, maybe right after birth, are there certain precautions that women should be taking, even if they didn't have any issues beforehand?
Absolutely. There's a condition called postpartum cardiomyopathy, which is almost a postpartum congestive heart failure type of syndrome. So patients who have had babies need to keep an eye on their symptoms. If they have swelling, shortness of breath, chest pain, that could be a significant indication of a problem with their heart. So communicating with their healthcare team is super important.
Yeah. Well, I know we talked a lot about the problems that can arise. So let's maybe talk about prevention and how we can prevent some of those problems. What do you suggest?
Absolutely. The commonsensical things that we all should do even when we're not pregnant.
Right.
Eat well, sleep well, watch your weight gain during pregnancy. It's important to gain weight during pregnancy, but not too much weight during pregnancy.
Right.
Take your medications as prescribed. Don't smoke. Don't have too much caffeine. Ask questions. When you go to your prenatal provider, make sure that you don't leave with anxiety because you haven't had your questions answered. We want our patients to ask questions and to leave feeling comforted that they know what's ahead of them.
Yeah, I know. I think it's important for women. Obviously, when you're expecting a baby, there's a lot of anxiety, right? There's a lot of the unknown, but that's not always healthy for you or the baby. So it's important to kind of manage that. Any suggestions on how to manage that anxiety that women might be having?
Well, exercise is a huge thing, and again, communication with your healthcare team. And I think the more information is comforting and reduces the anxiety. And anxiety and stress isn't good for your heart, whether you're pregnant or not pregnant. So, yeah.
Is there anything, if you're maybe thinking about becoming pregnant, that you should be aware of when it comes to your heart?
Well, for sure, if you have a pre-existing heart condition, you should speak with your primary care doctor or your cardiologist to make sure that pregnancy is advisable. And if it is advisable, what are your particular risks?
Yeah.
If you don't have a pre-existing heart condition, optimize your health before becoming pregnant. Try to get to your appropriate weight. If you smoke, try to quit smoking. If you have diabetes, try to get your diabetes better managed. If you have hypertension, have your blood pressure well managed. So that if you start out healthy with pregnancy, your pregnancy is going to be a healthier pregnancy.
Absolutely. Well, thank you so much. Great tips for all the expecting moms out there. Really appreciate it.
My pleasure.
And if you would like to learn more, you can just head to the website. You see right there, ahmgtampabay.com.